Hello, everyone. I'm Dr. Diana Bitner from True Women's Health. And joining me tonight for our Let's Chat is Mitch Shooks, the founder and owner of Grip Center. So Mitch and I were talking so much on this before we went live that we almost forgot that it was time to go live. So we have a lot of fun talking about the subject. So I want to start, just like we always start these, I want to start with, why does this topic interest me? Why is this so important that we're dedicating our Let's Chat to talking about muscle mass, or we called it flex appeal? It's so important to me because, number one, I've learned from studies of women and taking care of women over time that weight and weight management is something that's just near and dear to most women's hearts, and learning that muscle mass is critical to keeping our weight off. It also impacts our risk for chronic illness, such as risk of osteoporosis, risk of heart disease. It affects our self-image, our sex drive. So I've just learned over time that muscle mass is such an important thing. And, personally, I've had my journey with hip pain, and my PT kept saying, you've got to build muscle. And until I met Mitch, I'm like, I just want to ride my bike. But now, as I get my butt kicked in training every week, I've learned it makes me feel so much better, and my pain is so much better. So, Mitch, I'd love you to talk about why you're here tonight. You're taking time from your schedule and meeting with us tonight.
Yeah. Thanks for having me.
Of course.
Yeah, why it's important. I rarely get somebody come into the office and say, I have, extra 7 to 12 hours this week. How do I waste them? Generally, somebody is coming in, they say, I've got such a limited time. Like, what's the best use of it? Whether that's, weight reduction, body fat improvement, overall health. And weight training is the single best use of your time. Like, if you really have very limited time to exercise, it's going to be weight training hands down for people, just because there's such a big payoff. And we'll talk in depth about each one of those points. But really, I think the research has really caught up with that practical use, what the trainers have kind of found over the years, that if you are weight training, you're going to hit most of those goals you came to the gym for or started exercising for anyways. And I get a lot of the people who went the cardio route or some other way, and they always kind of fall back into the weight training eventually.
Yes. And yeah, again, my mind's racing, but I would love you to talk just briefly about how you got into this and a bit about your career, just to give people a bit of background. But one of your favorite sayings that I have, and you guys, Mitch has so many sayings, and some good jokes as well. However, he says, just because you're a bird doesn't make you an ornithologist. And what I've really learned from Mitch to respect about him is that he is evidence-based. What I recommend to my patients is based on good science, lots of experience. And number one, I want to keep my patients safe. And what I've learned from Mitch is he is evidence-based, man. Like, he knows, strength training versus endurance training, building muscle mass. He's sending me studies about how estrogen impacts muscle mass. Like, this is not only his job, it's his passion. And he wants to keep us safe, and he wants to help us. So, Mitch, maybe even just a little bit about how you got into what you do.
Sure. Yeah. I have that, classic journey of really struggling with body image as a young man. I was never the athletic guy. I struggled with, the PE class where your shirts versus skins. I was telling somebody today that it almost scarred me from working out and exercise. I hated that embarrassment that came with how I felt about myself. And weight training was an easy access. But back then, 40 years ago, nags, right? Like these bodybuilder things. So I'm doing these just ridiculous workouts in my basement, trying to get in shape. And I got really frustrated with it because I never made the progress I thought I should, or, I'd see other people in really good shape and why couldn't I do it? So that, instead of dissuading me, really got me curious, what is it that makes this work, and how does it go? And so I started in college as an exercise science major. And that was right at the birth of the internet, where some of this stuff was coming out. So my roommate used to tease me. I had binders full of, I would print every article, whether it was a science article or an actual, because they're more written articles back then. And I just had all these binders of .3 matrix printer stuff from the internet. And I had a voracious appetite for it. But even that, college didn't quite do it. in terms of giving me the answer. So I got really down in weight. I was almost 45 pounds lighter than I am now, doing the cardio, low fat thing. You know, I was borderline anorexic there. And when I got out of school, I got into the traditional gym setting, and I did well. I could get some results with clients, and I would say it was a good trainer for, you know, like the typical gym. But what happened is I got exposed to the next level of kind of putting the medicine side and thinking a lot deeper about this. And my mentor, a guy named Charles Pollock, when I started attending his seminars, and it really catapulted me into a much broader world of thinking and research and being scientific about it. And we'll show later like some body fat measurements. And then what I started to do was, like, if we measure these things, whether it's muscle mass, body fat, we track the workouts, we track the weight you're lifting, the reps, how often you do it, like we get kind of scientific. And I always joke in the office here with a client is that we only have a sample size of 1 in our study, and it's a study of you. And I don't care what worked for me or the last client. We need to figure out what works for you. And I think that's where that confusion gets for a lot of people. Is like, oh, where do I start with this? Like, this person says it's 10 sets of 10. This one says 3 sets of 10. This one says do HIIT work. And it's really confusing out there. So we really try to narrow that down and say, here's the best plan for you. Here's what you need to do. And unfortunately, yeah, there's a lot of birds in my industry. Like, they're pretty birds. They look like they know what they're doing, but they have no clue how they got there. I would much rather have the trainer who struggled with weight and had this journey where they figured it out, not just with themselves, but with other clients. Like, they have that relentless pursuit of going after their clients' goals to figure it out, because that's what makes you better for the next client and the next one. So that's kind of my journey.
Well, I appreciate that. And it sounds like mine in this whole world of midlife, menopause, and sexual health. Like, I'm super curious. And yes, I would say you're super curious. So let's get to, you know, what patients want to hear about, what people want to hear about. I made this list, you guys, of the 10 top things, the 10 top reasons that muscle matters. And, you know, the number 1, I think, is the most important. So let's start with number 10. Mitch has this list as well. So we're going to start with this. So number 1, muscle mass will help reduce your risk of falling. So I take care of a lot of patients, you know, over the age of 60, but again, of all ages. I fell in my garage about 3 months ago. I thought, that is so stupid. I didn't break anything, so my bones are good. But Mitch, how do you think about this?
Yeah, so there's 2 main things that really happen as we age. We have that sarcopenia, that loss of muscle mass, but there's a new one kind of emerging, what we call dynopenia, and it's a loss of that neurological efficiency of, like, catching yourself when you stumble, and kind of that coordination and muscle mass and weight training specifically kind of triggers that whole system and gets you ready for it. And in the case of you falling, yeah, you have stronger bones. You have muscle mass to stop you and cushion you in that fall. And it is a huge thing for protecting you, because, you know, once you fall and you break a hip or something like that, you might be out for months, and that might be the start of a really bad path.
Well, I think it's even interesting, as I get stronger, my form has gotten better. I mean, it's great to have the instruction, but it's also like I just sort of lock into that form quicker and easier. So it's like, it's that muscle memory as well. So to your point, in terms of, you know, catching yourself when you're going to fall, what I think is really interesting too, what increases a woman's risk of falling is fear of falling. So if we're less afraid, we're more confident, we feel stronger, that also can reduce our risk of falling.
Yep.
Okay. I have a bit of a frog. It's not COVID. I have a little cold. So if I get a little froggy, I'm just going to get my water here. So pardon me. Number 9, body structure. So muscle mass is so important for body structure, body form. Again, how do you see how clients think about this and how you help them think about this?
Yeah. I don't know if I ever told you this. The first company I had was LBN training for Look Better Naked. Because I had so many people come in and they're like, listen, I'm not comfortable. Like, I take my clothes off. I don't like what I see. I was like, yeah, everybody wants to look better naked. And yeah, that muscle mass to body fat ratio, that's a big deal. Actually, if you guys could throw up that body fat assessment, I'll actually show mine. So here's mine over the years. And this is one of the ones we use in-house. This is called a biosignature assessment. So where your hormones have been are indicative of where your body fat will be. It's kind of KPI or an indicator of where things are going. And you can see it changes quite a bit, right? Like I get leaner, I get fatter, like just depending on what I'm focusing on. And this is one that we'll use to kind of look at that muscle mass and strength. But what's great about having a measurement, when you come in, you can improve what you don't measure. So if you don't know where your body fat is or your muscle mass is, you don't know if what you're doing is working, right? Is it 1 day a week of weight training? Well, maybe that works for a month or two, but then it plateaus, and then you need to add a second or a third or a fourth day. And so having measurements can really, as uncomfortable as you might be coming in, like it's rare unless somebody's like been doing all this stuff and they know they're doing a really good job, they don't want to get measured.
Right.
But sometimes when we're really off, that's the time we need the measurement, because that's the key to kind of getting back on track. So
right. Well, especially I see a lot of women in midlife and menopause. And again, I first met you because my patient said, you've got to meet Mitch. He gets midlife women. He gets what we're going through and how we don't like the belly fat. And we talk a lot about belly fat, how it can lead to chin hair. It can lead to baldness. We don't like that midlife weight gain. And so being able to see that on that biosignature and see actually the picture that one gets from that, to see where that weight is. And then over time to see that weight decrease.
Yep.
Again, I like how you can focus on different exercises, different food choices based on where someone has extra weight.
Yeah, for sure. Yeah. And that's the great thing, right? Like, because if you're going to try something because modifying your diet's difficult. We get into this rhythm of what we eat based on a lot of things. And so to change that, right, to make new foods or to eat at a different time or a different amount, it's really tough. And you want to know it's doing what you intend it to do. That's where measurements are key on that. And that should hopefully reflect in our body fat and our kind of image there.
So how does muscle mass help with our body structure? How does that help us achieve our desired body structure?
Yeah, so there's a couple of things. There's kind of a thermic effect, right? Like we have more muscle. There's mixed reviews on that. We used to think that was really what boosted the metabolism, was all this extra muscle. I don't know if that's necessarily true, but it certainly makes being active a lot easier, right? If you are strong and you have that muscle mass, like everything takes less effort. Going up the stairs takes less effort. Grabbing your groceries takes less effort. Playing with your grandkids takes less effort. So you're more likely to do those things that end up burning calories throughout the day, which is great. Plays a big role in posture, like sitting up straight and that muscle imbalance. Yeah, right. Yeah, because we live in this age of like hunched over our keyboards and having that like just physical structure of how I look and how I present myself really plays a role in there.
Well, I ask women a lot, like when we talk about their picture of self and their goal for a future event. I have how many patients that, their goal this summer is to not only maybe look good in a bathing suit, but maybe they have a wedding or a graduation, and it's about how their arms look.
Yep.
How do my arms look in a sundress? I'll say, okay, what do you want to wear at that event? Well, I want to wear a sundress and I want my arms to look good. So I think it really comes down to that. And of course, having not only less fat so that your muscles can show, but then it's having that form. So when you put your arm on your hip to take the picture, you've got a nice little cut line. So
you got some muscle mass to show off there.
That's right. Okay. Tip or number 8, sex drive. So I wonder what your take on this, but a lot has to do with body image, but we know that women have better libido with more muscle mass. And, is it self-image? Is it how they feel when they, how they look when they're naked? Is it, sort of a get up and go? Is it having more energy? What is your sense, Mitch?
Yeah, those are actually probably the big 4. So 1, we know weight training increases testosterone, and that's a big link for women, at least on the hormonal side of things. 2, if you have more energy throughout your day, right, at the end of the day, when that's likely to happen, you're probably a little bit better there. Definitely, women are way harder on themselves than anybody else is ever going to be. And if they start to feel good or feel like the way they look, yeah, you're going to feel sexier. And then the other thing too, there's a natural like boost when you're doing the things, like you took time out to go kick your butt in the gym, to eat a little bit better, to get that exercise done. Like, just everything, there's a rosier glow in the world with that. I don't know how you'd quantify that, but it's, right. I think that documents, because there's a really strong correlation. There's probably over 30 plus studies I looked at that that you get a reduction in depressive symptoms when you start weight training, and stands to
Exactly.
reason those two would correlate pretty highly.
Yep. And I love the statement that you can't give when your bank is empty. And
Yeah.
so I really do see that when women weight train, they exercise, they're giving to themselves, so they're more likely to want to give, even if it means in terms of their time and energy for sex. So I think that really is a big deal. The other thing I think about is when, one of the biggest killers of sex drive is distraction. So I'm thinking about my kids, I'm thinking about my job, the grocery list, like, can we just move this along already? And so it's, if we're practicing being in our body, I mean, when you're lifting weights, especially if you're doing freestanding stuff, you got to be paying attention, right? You don't want to, like a skull crusher, drop it on your skull. So you've got to really be paying attention. So if you're practicing being in your body, being focused, it really does help concentration. It helps orgasm, all of that.
Yeah, I like that.
So that's big. Okay, so number 7, healthy bones. So this is huge. I love thinking about, our muscles are attached to our bones. So if we have stronger muscles, they're pulling on our bones, and our bones then know they've got to be stronger. So it promotes overturning bones faster and building them up. How do you think about this?
Yeah, I think we often forget that bones are a dynamic living tissue, right? Mm-hmm. They respond to stress, and I always joke, like, with back to that first point, reduction in falling,
right?
And the healthy bones. Like, I just laugh sometimes when I'm with my kids. I watch them like jump onto everything, and they're balancing on railroad ties and like hopping over rocks. I'm like, oh, you're gonna roll it, but no, that's actually what develops our system and kind of prevents us from that stuff. But there was a really interesting study. So I used to think the only indicator we had to worry about was stress through the spine throughout the year. So if you looked at somebody's training log at like an Olympic level, some of these females, and how much weight they lifted, so they might lift a couple 100,000 pounds over the course of a year, and that directly correlated with their bone mineral density. But now there's some new studies showing out that even just moving and doing some weight training, even if it's not like that super stressful, it triggers the same reactions to increase bone mineral density, which is huge. So it's a more of a, rather than just a specific, I'm going to get bone mineral density in my hip or my low back, it's global. The whole system actually improves quite a bit.
Sure. Well, I'm a swimmer as well. And so when I was big in my swimming, I was worried it wasn't good for my bones. And I read a study that doing the push turns and pushing off the wall actually was enough to help maintain bone mass. So I was excited about that. Yeah. And also I was interested, I saw a study about astronauts. I mean, they strap them to treadmills and make them run up in zero gravity because they can lose up to 30% of bone mass in a year.
Yeah, it's remarkable.
It's crazy. So super important for bones. And, I get bone densities on every one of our patients who has at least 2 risk factors, 1 being menopause, 2 pretty much being a woman and living in Michigan and all of that. But I've had some patients who are really shocked. I'm 54 and what? I have osteoporosis? Like, come on, that's what 90-year-olds get, right? So it's a real shocker. So number 1, you can't manage if you don't measure. But number 2, it's so important to start this at a very young age.
Yeah.
Okay.
Yeah, it's never too late to get going. It is remarkable because we've had some late life studies, like people in their 70s and 80s start weight training, and the amount of muscle mass and strength they can gain is almost like a teenager. It's really remarkable. So I think our oldest patients right now are 85 and 86. It's a couple that come in 3 times a week. And before that, it was my great uncle was 93 and would come in and strength train twice a week. I mean, I love that because it's like you just do these movements that keep them doing life, right? Like that's one of the great things about weight training on that.
Right. Well, I guess that brings up another thing I want to make sure people know. Like, Mitch at his gym, I mean, it's a perfectly proportioned space. It's not too big, not too small. There's machines, there's stuff everywhere. It's very organized, very clean, but it's not just this. I like to go early when it's mostly to the guys and people are just about their business. But, there's people of all ages. There's men, there's women, there's teenagers, there's 90-year-olds, like I really was actually surprised by that, Mitch. Like I just pictured like a guy with a gym. It's going to be just this sweaty muscle place. I don't know how to describe that.
Yeah. I think we've worked very hard on that. to make sure like one of the things, when you were talking about my upbringing, when I joined my first gym, I would drive there. I had a key to it. Like every member had a key, and I would sit out there till the last car left. And then I would go in and work out until the first person showed up, and then I would leave right away. I was just so embarrassed to be in the weight room. And I get people come in all the time and like, listen, I'm not a weight trainer. Am I okay to come to your gym? I'm like, listen, everybody's welcome here. Like, you've worked with the most of my staff. Like, I have this awesome team of trainers. Yes. And one of the things that I love about them is they are some of the most welcoming. They have some incredible stories of like how they got into fitness and what really brought them into it. And they get it, like this is an intimidating place for a lot of people to come. And in the big gym, I don't want to be on display working out in front of people. And so, we have, there might be 4 or 5 other people working out, but it's generally a pretty intimate setting where you can really get comfortable with weight training. And it's surprising the ones who like almost are the worst, like I'll never be able to do it, end up just loving it, because it's this awesome sport that's only about you, right? It's not about what anybody else can lift. It's about what you can progress to. And it's one of the things that really I love about weight training.
Yeah, well, and it's really cool too, because, I see how your trainers keep track of, okay, you did this last week, and, just how you can get better, what you like, what you need to get better at. It's just really fun to have that focus. And I think about it. I only go to your gym once a week, and then I work out at home the rest. But it's almost like, I don't know, did you ever take piano lessons? Yep. It's like your piano teacher knew if you didn't practice.
Yeah, for sure.
I know that if I don't lift those other days, then Darius will know, because my weight will be lower next week. So it's like, it's great for the accountability. So it's kind of fun. Okay. Number 6, mobility. I love thinking about this. Like, heaven forbid I fall down and I can't get up. And if we think about falling and getting up, that's doing a push-up, right? Maybe it's a girl push-up or from a knee push-up, but it's a push-up. So, heaven forbid we, again, fall and can't get down. So how do you think about this, Mitch, in terms of people's mobility increasing with muscle mass?
Yeah, so mobility kind of ties into a couple of things. What's my strength? What's my flexibility? And what's my stability? It's kind of putting all those things together. And there was an interesting study that they did a correlation to, like, if you sit crisscross applesauce on the floor and can stand up, the number of touches you have to make with your hands to get up was actually a correlate to how long you would live. So the lower, the higher. There's a lot of things that go into that. So, correlation, causation type stuff. But it got me thinking about that. Oh, what are these elements of when we do training for people? Like, it should always transfer out of the weight room. It's really sexy if you can push a lot of weight on that machine. I don't care if that doesn't translate into you having a better day, or going up the stairs easier, or getting out of a chair, or being able to go on a longer bike ride. Like that, able to get off the floor is just part of everyday living. Like, you might not pick something off the floor, especially, if you think if your back is really bad, like you're just kind of kicking things around, but some of that happens as we age, where we just know, like, oh, it's so much effort to get down there. Right. It's the double-edged sword of, it's hard for a little bit, but then it makes everything else easier.
It does. That brings up 2 thoughts. I had a patient recently who, I always ask at their first appointment, what's hard for you? And she said, what's hard for me? And she got teary. She says, I can't play with my grandkids. I can't get down on the floor. Yep. My back hurts, my hip hurts. I feel weak. I'm afraid if I get down on the floor with them, I won't be able to get up, and it'll be embarrassing. One time my grandson said, Grandma, what's wrong with you? Why can't you, do whatever? And she said, I want to be able to play with my grandkids. That's her goal. And so the reverse happens to so many people. If it hurts, I'm not going to do it. Yeah. And the less people do stuff, the more it hurts when they do it. So it's like, we've got to break that cycle. The earlier we can break that cycle, the better.
Yeah. I don't know if that's in our top 10, but there were some really interesting studies that people who weight train have almost a 50% reduction in pain perception. And we know this in arthritis studies too. It hurts while you do it, but it cuts down the pain the rest of the day. And that's the other thing about getting experts to help you guide you through this. Like if you do the wrong exercise, I've always joked, it's like not brushing your teeth. Like, you're probably good for a little while, but later on you're gonna have some problems. And we call it piling fitness on dysfunction. If you don't fix these imbalances and the dysfunction right away, you get more fit, you get stronger, but we've got all these underlying like Jenga stack that's about ready to fall over. It might be taller, but I don't know if it's much better. And so we try to really pay attention to muscle imbalances and flexibility and those kind of components when we put a program together for clients.
Well, I remember when I first came in to see you, I had been showing off water skiing before I came in, and I tore the connection of my hamstring up into my pelvis. And when you first tested me, my one leg was so much stronger than the other. And so for a while, you really worked on getting that one leg strong enough to be equally strong with the other. Because again, I was just having more and more pain. And now, a year and a half later, I am lifting more with my hamstrings than I ever thought, and they're equally as strong.
Yep.
So, I just remember respecting that so much that you picked right up on that, and we corrected for that before we went forward. So if I had just been working out on my own, I would never have noticed that.
Yep.
And I was able to work with you and my physical therapist, Jeff Clark at iMove, and I was able to put the two together, and now I'm pain-free. And maybe actually once you guys give me the all clear, I'll be able to water ski again.
Yeah, maybe without the show off.
No show off. Yes. No more show off. And it was the end of the day. And of course, the last run, it was just stupid, but I learned my lesson. Okay. Number 5, self-image. This is critical. I mean, sometimes we'll laugh, like when you see people working out and they kind of start walking around. What do you call that? The fake lat syndrome?
Yeah, imaginary lat syndrome.
What do you call it?
ILS, imaginary lat syndrome.
So tell me about how you see people change over time as they come to see you without much muscle mass and they gain it. What does that do for self-image?
Yeah, it is one of the things my assistant Cindy is fantastic about. She probably notices that more than anybody, and she tries to, sneak videos, and we try to capture videos with the clients like during their first few workouts, because it's such a difference, even just in your confidence in the weight room, how you move, how you carry yourself. I think one of the other things too is a lot of times we come in and I'm not very strong. A lot of women are like, oh, I just don't have much strength. I don't do any of this. And this is another great reason why you got to get with experts, is because, I get these women, I work out and I've got, these 2-pound weights, and I've really been, I've worked my way up to 3. I was like, honey, that's like a 20 to 30 pound lift. Like, we really got to push that. And they're just astounded by how much they can lift,
Right.
Under proper supervision, and then how much you can progress at. And when somebody tells you, hey, this is the safe way, this is how we do it,
Right.
it's just awesome. And that goes from like, I'm weak to, wow, I'm actually pretty strong. And what's even better is when they go work out somewhere else and they work out next to another woman and they're like double or triple the weight, and they're, and that's just become their new norm. And then they start realizing, oh, I actually am strong. It's a huge boost for self-image.
Well, and I think it has to do with so many women, they come in and say, I don't want to feel old. Aging is inevitable. It's how I age. And so when women feel strong, when they feel capable, it's pretty cool. And, I had a patient who said, her son was like, geez, mom, like, you're getting kind of buff there. Like, maybe you need to back that off a little bit. And she's like, are you kidding me? Like, I feel awesome. So, I think it's really critical to how we feel as we get older, like, especially, women who are 80 and still able to lift. And be active and go skiing and, all of that. So it's a big deal. Okay. Reason number 4. Here's our pain reduction, right? So it's huge. And again, I see a lot of women who complain of SI joint syndrome, which can come from a weak core and tight hamstrings and the hips off. And, by really having a strong core, a stable pelvis, learning how to strengthen those muscles, but also relax those muscles. And you were saying you see this a lot as well. Yeah.
And some of that too, we get trapped into a range of motion in life. Like I get in the car, I get in a chair, I get out of it. Maybe I don't push some of that. And in the weight room, you can have that safe space to say, hey, we're going to gradually increase some of that. You get a change in tissue length and tissue quality, the fascia changes. That's probably some of where we see that pain reduction happen, just from the lengthening and strengthening of the tissue. But that's an exchange of nutrients and blood flow and all kinds of things that happen when we start doing that. And that's probably the main the main reasons for that.
Don't you think about it too? Like a couple times I've had dry needling, in muscles or, that are damaged and that are just painful, like different areas of tendonitis. And I think it's a little bit the same thing, right? Like when we weight lift and we're lifting heavier weight, we're breaking down that muscle so it can rebuild. And so we're creating almost this inflammatory response. So when there's that healing response, I bet that's part of it. Just like, let's say, a dry needling.
Yeah. Oh, very, very much so. Yeah. It's kind of fun world because we're getting a lot more mechanistic research of like kind of what's going on. We know these things happen. We just don't always know why they're happening. I guess I don't need to know the why so much, like, hey, if weight training makes me feel less pain, and I've been through some pretty bad stuff with back surgeries and all kinds of falls from mountain biking and stuff like that. It's like my passions. I like those things, but weight training is kind of my buffer so I can keep doing the things I love later on.
By the way, everyone, I know Mitch and I were having this conversation and we could talk all night, but please feel free to throw in your comments, throw in your questions. If you're watching this after the fact, feel free to reach out to us and direct message to True, and we'll get your question to Mitch and we'll be able to interact that way. So please feel free for comments and questions. Okay, number 3. So let's talk about this. Muscle mass can be a source of amino acids to fight infection and to tolerate cancer treatment. And, again, the mechanism I think is still being worked out, but, we know that women who have more muscle mass tolerate, let's say, getting bad COVID or getting a bad pneumonia, or if they break a hip, they're able to heal faster from that hip fracture and that hip repair. I saw a study that showed that women who were 70, women who get lung cancer, for example, if they get cancer and they have muscle mass, they do better. Yep. They survive. Women who don't have muscle mass and get cancer, they don't do so well. Yep. So I see this as just critically important.
Yeah, there's a strong correlation between muscle mass and longevity. We lose on average 3% of our muscle mass every decade as we age. Not that has to happen. That's just generally most people aren't active enough when they're doing this. When you are bedridden, let's say COVID, a really bad case of COVID, it's 7 to 9 days. You can lose 10% of your muscle mass, which is like 3 decades, 30 years worth of muscle mass loss.
In 10 days.
In 10 days. And so if you have that extra muscle mass, it becomes a buffer so that when you are out there, it is a reservoir for the immune system. Your body will break down those proteins to use later on. It's super critical. I don't know. Yeah, I don't know the exact mechanism of it. We just know that if you look at muscle mass and strength, there's almost a direct correlation to how long you will live. And also, not just length of life, but we want to health span. Yeah, we want to live great lives longer.
And I've taken care of patients with even metastatic breast cancer who are lifting weights, who are working out, they're walking, and they feel better, they tolerate chemo better. And I've had several who say their oncologist said they did so well and they cured their disease because they were so strong and healthy when they got it. So that's how I think about it. If I or a patient or a friend or a family member gets cancer, I want to make sure that they're as healthy as possible so they're most likely to survive the disease.
Yeah, for sure.
So super important. Okay, reason number 2, insulin sensitivity. So Dr. Egan, my partner, who's board certified in obesity medicine, she has just taught me this even more. And a lot of us, Mitch, I don't know if you've got your CGM on. I don't have mine on right now. Yes, but it's the continuous glucose monitor. So it's so interesting that as people gain muscle mass, they can more likely tolerate some carbs, for example, but they're more likely to store their calories in muscle versus in fat. So this insulin sensitivity is so critical for our health, our longevity, and muscle mass improves it. I know, Mitch, you study this. You're so curious about this. If you can share just a bit of what you've learned.
Yeah, all right. You're going to have to tie me down if I get too far off on this. So muscle mass, if you think of your insulin receptor sites as like parking spots in a parking lot, weight training is like adding more parking lot. So it just gives you more place to put those carbohydrates. It is. So I pay attention to a lot of this with our clients because insulin, the more we produce, it's almost like a gas pedal on aging. So if you look at like how often we're producing that and where if we can't store it in the liver or the muscle, it has to get stored as triglycerides and then as fat. And it starts that whole metabolic syndrome process. So
Right.
we know weight training is one of the best things to cut that whole process down, along with, managing the type of carbohydrates.
So I just want to step in because, the whole thing is if we're more insulin sensitive, then our pancreas doesn't have to put out so much insulin.
Yeah.
And so that's where the sensitivity comes. So the little bit of insulin that's there is able to get our calories, our carbohydrates into our muscle so it doesn't go up in our blood. If we're insulin resistant, then what happens is our blood sugar rises, our pancreas sees that and says, and it releases more insulin. So then we get higher and higher insulin levels. For example, higher insulin levels, it hurts heart muscle cells specifically.
Yeah.
So if we were to have a heart attack someday, heaven forbid, then we're more likely to kill more of those heart muscle cells.
Yeah.
So, and we're less likely to recover well. So again, it's all about keeping that insulin level low and just really responsive to what we're eating.
Yeah. The other new pathway they've kind of seen is, we used to think when you go for that walk, you're burning that glucose. Well, that's true. You do burn it when you're weight training and working out, walking. There's this mechanism called the GLUT4 transport, and think of it like a straw in the cell, and the straw comes up to the outside to take that sugar and pull it in there. And we used to think you needed the chemical activation of that, but turns out just moving, working out, actually starts that process too. And it's another way, even before having that extra muscle mass, that we lower that glucose and become more sensitive to it. And yeah, it's interesting. I was just doing some study on this, and I just learned, we know about non-alcoholic fatty liver disease, which is a huge problem. I mean,
it's growing.
It's growing like exponentially, and it's tied with type 2 diabetes. It's type 2 diabetes, and kind of where we're seeing it's a problem with too much sugar and too much insulin. Like you said, like if we look at our fasting glucose, it's one way to look at it. But I was explaining to somebody the other day, if you and I have the same income and we have the same bank account, where I'm making 100 grand a year and you've got 500 grand in the bank, and so do I, but I'm working 4 times harder than you, one of us is going to die sooner. And that's kind of what happens with insulin sensitivity. We might see the numbers. It's working way harder to keep that number down there, but it's doing way more work. And they've now identified this non-alcoholic fatty pancreas disease. And I'm like, oh my gosh, like they're doing MRI studies on it, and we're seeing this kind of tied into inactivity and too many carbohydrates, really highly processed carbohydrates and fructose in our diet. And so, yeah, weight training, insulin sensitivity, it's a huge component of why it's so important for us.
Right. And, I see a lot of women in midlife and menopause, and what happens as our estrogen levels drop is we become more insulin resistant.
Yeah.
And especially if you are a woman who had diabetes in pregnancy, you have a strong family history of diabetes. Genetically, I see women of Asian descent have a very high insulin resistant at a very low body weight. Some women of genetic backgrounds, it takes a lot of weight gain to get insulin resistant, but certain genetic groups, they don't take as much weight gain to do this. So again, muscle mass helps us stay insulin sensitive. So I have a question from Laura. Hey, Laura, I love you coming in always. How often a week should you be working to maintain muscle mass? Mitch?
Yeah, so maintain it. It doesn't take a ton. 2 sessions a week, probably 45 minutes to an hour. If you're really untrained, let's say you've never really weight trained, at least formally, 1 to 2 sessions will actually build muscle mass for about 3 months, and then you'll be able to maintain it. But then at that point, if you need more muscle mass, you need to add a 3 or 4. At around 4 hours a week is where you can continually make pretty good gains in muscle mass. But to maintain it, it's a little bit less. It's kind of nice. Like, so if you've been active your whole life and you want to just keep, spend some time doing more outside activities, 2 days of weight training is enough to keep that maintained. But you can improve your strength in those 2 hours a week. So you may not get more muscle mass, but you can get a big improvement in the strength quality.
Nice. Cool. Thank you. Okay. Reason number 1. Muscle mass allows you to have the ability to do the activities that make you happy with people you love. I mean, this is such a big deal. Again, we ask every one of our patients at True, What is your picture of self? What do you want to do? And so many women, it's, I want to keep up with my kids. I want to keep up with my husband. I want to go kayaking. I want to go ride my bike. So, that muscle mass keeps us able to do these activities. And Mitch, I imagine you see people like this all the time that come in and they can't do stuff. And then after, 4 months with you, they are able to do what they want to do.
Yeah. Or that thing is so much easier to do. Like golf used to hurt my shoulder, or I'd have back pain, or I couldn't believe how much easier it was to get up on my water skis this year. That's one of my favorites because we work with a lot of women who like to water ski, or, even I'm able to do those activities and I'm less injury prone. We spend a lot of time on hamstrings, and women are, I think it's like 6 times more likely to blow an ACL than men just because of the structure of the hip to the knee. And if you strengthen those hamstrings, we can almost zero out that risk and protect it. So, nobody wants to have an ACL tear, but God forbid we have one later on in life when everything takes longer to heal. And so if we can protect you and keep you doing those things you love, game on.
But not only longer to heal, but a lot of times then that's when women gain that 20 pounds.
Yeah.
Because not only are they not mobile, but people bring them casseroles and they're depressed and tired. So they're eating pasta and they're sad.
Well, then you're active and you're losing that muscle mass, and that's that insulin sensitivity. It's a big cascade of all of those things.
Exactly. I love this question from Kristen Harrison. Thank you. She says, 6 weeks ago, I began following the starting strength method. Mitch, this is all you.
Yeah. I'm going to have to pull a refresher on the starting strength. Because I'm not familiar with all the ones out there. I'm going to see if I can pull it up real quick, unless you've got a real...
I don't know this. So let's go to Nora's question while you pull that up, or Nora's comment. Nora says, I just came back from vacation where my daughter and I had hiked 8 to 13 miles a day in the mountains and canyons. I would not be able to do this even 6 months ago if Mitch and Connor would not push me during my training days. Thank you both. Now I want even more. So I just got shivers. This is why Mitch and I do what we do, you guys. It's just the best to see people feel their best. And, what a great comment.
Yeah. Okay. So starting strength, that's Mark Ripeto's work. He's a great coach. A lot of barbell kind of work, big movement stuff. My only concern sometimes with that is people aren't always prepared for that. They don't have the mobility. And so like independently doing that thing can be a little risky, but if you're comfortable in the weight room, great stuff. So, but here's the thing to remember. Any program you're doing is only good to adapt to it. So the best.
Say that again, Mitch. I didn't hear you. Said it fast.
Any program you're doing is only good until you've adapted to it. So if you think of it like your child comes home from first grade and he's got C-Dick run, and then 6 weeks later he comes in and he's got C-Dick run, and then 3 months later you're like, man, my kid's either not that smart or this teacher's missing the point here. Like doing the same program has a benefit as long as you're getting something from it. But generally after about the 4th to 6th exposure to it, you're getting all the good stuff and you're starting to accumulate the bad things. So when you're here at GRIP, every 4 to 6 weeks, we're writing a new program for you. And so I'm pretty sure starting strength has progression built into it. But it's one of the things to think about when you're like, you get comfortable in the weight room with your routine, but if that routine doesn't keep changing fairly regularly in a very like thought out way, it can actually be somewhat counterintuitive, but it's a little bit dangerous. So.
No, that's awesome. Yeah, I think Darius just changed my program. I'm doing a ramp again. So it's where you do an exercise and then you go hit the sled, and then you do that exercise and the next one you hit the bike, and that exercise, that another, and then so it's putting that hit in between, and it's awesome. But again, having that change up, plus it keeps it interesting. Not that it's boring, but it just it keeps it interesting as well.
Yeah. The interesting thing about putting HIIT with weight training, so cardio, weights, they both burn calories, but when you put those things together, you actually get a 30% synergistic result. So you actually burn way more calories. You get a different hormonal response. There's a lot of science behind the stuff we do. You guys just know them as this one sucks. It's really hard. And on the backside, we've got all this kind of like, all right, what did we just do? What did we do last? How often is that person coming in? We're putting all those things in when we're writing your program.
No, that's awesome. And I love how organized you are about that and keep track. And then, and then do the measurements. It's really fun to see that change. Emma has a question. I love this info. Is there any chance I can get links to research you spoke about on insulin sensitivity and muscle mass? I might have a couple articles. We can post these on the site. Emma, if you would just check back on our site, and we'll make sure that there's links in the article. So I've got a couple I can pull up, and Mitch, I would imagine you do as well.
Yeah, it's for me, it's narrowing it down to like, what's your best source? When I give that advice, it's like I usually like to talk to the person and get like, are you a podcaster? Do you have a medical background? Do you want just straight research? Do you want kind of layman terms? There's some really fantastic. I mean, I love YouTube and all the podcasts. You can learn almost anything. I mean, a lot of the stuff I learned after the fact was literally watching, like grad level like classes online that are free, and you get this free education. So there's all kinds of stuff on there. But I get it. You don't want to just blindside and Google something because you never know if that's quality stuff. So I'll give some links in there, probably at different levels, so you can look at what you're or find what you're looking for.
Awesome. So Emma, we'll make sure and get that posted ASAP, hopefully even by tomorrow. I see Judy Hop. Hey, Judy. Love hearing from you. I miss our days back delivering babies. She says, I've been working out strength and weights for several years, lost a lot of weight, diagnosed with osteoporosis and osteopenia. So just even from my initial, Judy, we live in Michigan, and for years we didn't know to take vitamin D. So I'd be really curious where you started with, right? So again, and Mitch, if you could talk about this again, number one, yes, of course, if your mom had it, you're more likely to. Number two, again, we didn't know to take vitamin D until about 10, 15 years ago. So that was a time where if you don't take D, you don't absorb calcium, and the bones need calcium to build. Mitch, you were speaking that it's never too late.
Yep. Yeah. And the thing with that, like when we go back to measurements, if a lot of times when we get that osteoporosis, osteopenia stage, it's later on, and there's something that's kind of triggered the doctor to look for those things. And I really wish we were a little more proactive on some of those things. So we had one in your 30s, your 40s, like decade after decade, we could have seen, where you started, because maybe those years of weight training actually had slowed a progression that might have genetically been a little bit faster. Maybe you would have lost 3% a year, but you only lost 1%. Or maybe you actually reversed some of what you had before when you added that. So it's kind of tough when you only get that one or two measurements later on in life, what that is. But you're right, quality of nutrition is huge. Vitamin D is a big one. There's 27 components to bone. And so we often get vitamin D and calcium. And my joke with that is like, if you get like throw more flour in a cake to try and get more cake, you're going to end up with a really crappy cake. And I feel like sometimes we just over the counter, people are like, I'm going to take calcium because they know that's part of bone. And it's not the only answer. Really, you want to have a better discussion with your healthcare provider on what you need to do.
What's so fun is when we have patients have a bone density, then they come back and see Suzanne. Suzanne is our PA who is trained in functional medicine and is really comfortable talking about all the different supplements, about zinc, about selenium, it's magnesium, potassium. It's really important to think about all these other elements of those supplements that we take. So again, if you're a part of True and you haven't seen Suzanne yet, I really, call and make an appointment so you can see her and talk about your bone health. So thanks, Judy. I hope that helps, but keep up the good work, and you're going to be okay. The other point I guess I want to make on that is just because you have osteoporosis doesn't mean you're going to break something, right? If you're strong, you've been building muscle, you're less likely to fall, you're less likely to be afraid of falling. And if you fall, you're less likely to break something. So it's all about balance training and strength. So kudos and keep up the good work. I see Kate and Carrie Ann have both asked about menopause belly. Again, this belly fat tends to be related to insulin resistance. So when we have less estrogen, we're more insulin resistant. So number one is is estrogen safe for you? And that's in one of our tips. And also build more muscle. Like Mitch, how would you answer this?
Yeah. Okay. I mean, I wish I had that magic pill. When we do this, we get rid of that menopause belly, super easy. It is an uphill battle. I'm not going to lie. I think way too many people overpromise on that, but you're right. Yep. It comes down to insulin management and a couple other factors, but because of the mechanism of, if you become insulin insensitive, we have this other axis, the hormone cortisol, which raises our belly, or our insulin, and those corticoreceptors are on the kind of the belly, and we get stressed, right? Like that menopause age, you're stuck in the middle of everything. You got teenage to young kids sometimes, to you're dealing with aging parents, and businesses and life are changing. There's a lot going on there, and it's sometimes the busiest I ever see clients at, and so. Weight training sometimes can even be those 2 hours where you just took out of your week to say, I'm important enough to carve out 2 hours for myself. And that's a big stress reduction, helps with that cortisol response. But yes, increasing the insulin insensitivity is one of the major things we're going after when we do that.
Right. And I love how you bring up this point of stress. We have a patient right now, and both Dr. Egan and I have told her, dude, you're working out too much. You're working out too much. So it's she's stressed at work. She's stressed with her parents. She's stressed with her kids. She's stressed with, am I working out enough? And she's really kind of stuck at this weight. And I talked to her, like, when you eat, when you're stressed, the calories like have no choice. Cortisol is crazy. Your insulin's up. It's pushing those calories straight to fat. So, it's a really big deal. And the other thing about the menopause belly that I've learned also from you is, I remember you told me, hey, doc, it's also about calorie reduction. I'm used to eating like my 40-year-old self, and I can kind of eat whatever I want. I'm working out. I can eat whatever I want. No, I can't. So, for a while, you made me take pictures of everything I was eating and send it to you. It really was an eye opener. So it's also being, cognizant of how much am I eating, and again, the quality of the food. But, it's all of this together. And but let's get to the tips, because there's also a point I want to make about estrogen.
Okay.
So the list of 5 tips that I want you guys to be able to take away from tonight, number 1, know your numbers. You want to talk about this, Mitch, a little bit? Body fat and muscle mass are key.
You can't improve it if you don't measure it. They're quick tests. And then when you measure it, keep measuring it to see if you're moving the right direction, because don't be afraid when it doesn't. Like menopause it's frustrating. Like it's like somebody dropped coffee on your laptop. Like things aren't going to work the way they did before the coffee. And you have to figure out which buttons are still working, like, so if I press the low carb button and it works, great. But maybe you need more carbs, or maybe you need more sleep, or maybe that glass of wine at night isn't so good for you. But you keep measuring it until you find one of these things that are working at. And don't be afraid of the measurements. They're just measurements, and you're not good or bad based on that body fat. Like,
right.
Just I wish women would be easier on themselves sometimes about that.
Well, and we do have some patients, of course, with a history of an eating disorder. And so, again, we're very respectful. And it might even be, would you be willing to get those measurements, but you don't have to see them. Don't look at them. And it will help me guide what I recommend for you to do. And can we just use a pair of your favorite jeans as your measurement?
Yeah.
But again, these are so important. So, for example, I remember at True, we have scales as well that measure body fat versus muscle mass. And I had this patient who, let's say her weight was 150, and she said, my goal is 140. The next year, she worked really hard over the year. We assessed her numbers. We addressed her insulin resistance. She started hormone replacement therapy. It was safe for her. And she came back a year later, and we had her, start of the new year visit. Her weight had dropped 5 pounds. She didn't make her 10-pound goal, but her muscle mass had gone from like 25 to 32, and her body fat had dropped from 35 to 28.
Yeah.
She felt like $1 million, but her weight only went down 5 pounds. It was like an eye opener. So if she had only had 150 to 145 as an assessment, I think she would have really beat herself up. Yeah. But she could see that she made an amazing change.
And she actually lost 10 pounds of fat, gained 5 pounds of muscle. I mean, I take that all day long.
Yeah, that's just the best. Okay, so tip number 1, know your numbers. Tip number 2, it's about deciding, what do you want to do to build muscle? Is it an intense 1-hour yoga session where you're holding crazy positions? Is it racing kayak? Is it being like Mitch and racing a mountain bike? I mean, Mitch, how do you think about this? I love to lift weights. I love to swim. Like, you gotta like it if you're gonna do it.
Yeah, weight training to me is that fundamental, like, It's kind of like saving for retirement. You're brushing your teeth, eating your vegetables. It's just something you have to do because it makes just everything else better. And it is this big investment. It just pays off later on. And it doesn't have to be like that's the only thing you do. It just has to be a part of what you do. And learn how to do it in a way that you like, and will continue to do and is effective for you.
And yeah, that's exactly it. But it's like who you're working out with. I love being in your gym and Jamie comes in. He's like, "Hey, good morning." So again, it's like working out with people that you enjoy, that you're learning from. Are you going for a run with a friend? Are you going to the gym with a friend? Like find your workout buddy and have fun with it. And Kristen brings up a good point. I think let's interrupt our tips to talk about this. How do I find balance between watching calories and giving yourself enough calories to make good muscle mass? I think this point is good in terms of, hey doc, need calorie deficit here.
Yeah, that's where the measurement comes in. It's really hard to consistently keep a calorie deficit. We're not wired for it. So this is how I generally explain it to somebody is like, listen, if we're losing weight too fast for you, we'll just add some more calories. But if that isn't happening, we're probably not in a severe deficit. What does happen though is as we age, we become less sensitive to kind of proteins in a sense. So you actually need a higher percentage of protein to keep that muscle mass on. And so one of the best lessons, you guys, you don't need me for this, is keep a note on your phone. Every time you eat something, you put it in that note, timestamp it, write it down, and look at that over a week and look at just that alone. You'll realize how often I'm eating, how much am I eating different foods or the same foods. It's such a good lesson that you'll start to pick up on a lot of things. Even before I do calories, I just do what and how often, because it's such an eye opener. And because even myself, I should know better, but I'm full of it when I think I'm doing it. So I'll get called out by my assistant when I do my food. She's like, "You're not even close to your protein goal." And I'm like, "Oh, you need sometimes that second set of eyes, even when you know what you're doing. But first, just start with what you're doing, record it, and see what's going on, and then probably the next thing is like get a little bit more protein, and then you can never do wrong adding some more veggies in there."
I'm eating way more veggies. Even I was eating a lot, but now I'm eating way more. Roasting them every week. Had a big salad and some fish tonight. So I'm loving my air fryer with the salmon and lots of veggies. So no, that's good. So again, tip number 2 is decide what you like to do to build muscle and then learn from it and learn to avoid injury. So tip number 3, what are your barriers? Are your barriers that you don't know what to do? So I've seen patients this week who they don't know about weightlifting. They don't know what that means, what it does. So like just name your barriers. I don't know what I'm doing, or I'm afraid of cost, or I'm afraid of, I don't have anyone to watch my kids. So what can I do at home? So there's all different solutions that I know, that Mitch knows, that, so it's just name it. So it's not cloudy and mysterious.
Yeah.
So I'm sure you see lots of different, not excuses, but a lot of different barriers, Mitch, right? Like it's
nobody's got the extra time, I'm just, there's always something. It's your schedule or something like that. But there's a really good book I read a few years ago called Essentialism. And I remember this analogy where he talks about like your life is like a closet that other people have access to. And they keep putting stuff in your closet. And pretty soon you're buried down with all this extra stuff and you're just looking for a few things. And what you need to weed out of your closet are the 4 outfits that you love to wear, that make you feel good, that you look good in. And all the other stuff is fluff and extra. And I'm constantly looking at that, like, what can I get rid of? What am I, like I love Netflix, I love reading, but like sometimes at the cost of other things, so can I get a little more efficient on some of this stuff? Or for me, like my weekday it's pretty hard for me to even get my weight training done. So now it's Saturdays and Sundays are 2 of my big weight training days. I come into the gym, it's empty, it's quiet, nobody's going to interrupt me. But that was never a thing for me. And so like I've learned to modify that. And yeah.
Sure. And Emma asked, what was the name of that book again? Essentialism?
Oh, Essentialism. Yeah. Yeah, I think you can Google that one right on Amazon and find it.
Oh, cool. So tip number 3 was, what are your barriers? Tip number 4, do that, put it on the schedule. So I always recommend to patients, whatever day it is that you make your schedule for the week, that you look at your work schedule, your kids' schedule, your parents' schedule, your partner's schedule, like put exercise on the schedule like you would a doctor's appointment. You know, today was busy. I had to be up early. And so I still am going to work out tonight. And so that was just, it's on my schedule. And so I know the days that I can work out in the morning, days that I can work out at night, and I just make it work. So if you don't put it on the schedule, it's not going to happen.
And you don't have to put a long one. You know, if it's 10, 15 minutes, great. Just get something done.
Right. Exactly. Quick question by Pauline. What about diet pills? So again, define diet pill, right? So Dr. Egan, who is my partner at True, she is board certified in obesity medicine. And a lot of weight management has to do with mindful eating. It has to do with your measurements and your history and all of this. And for some people whose metabolism is stuck in a rut, sometimes there is a role for medication. And these medications, I would say, number one, they need to be prescribed by someone who knows what they're doing, like Dr. Egan. She is board certified in obesity medicine. So these are medicines that I don't feel comfortable prescribing because I don't know them that well. I don't have her experience. I haven't read all the papers. I haven't sat in lectures by the world experts on the use of these medications. And so there are some medications that are not safe. There are some medications that might not be safe for you, but they're safe for somebody else. So, you know, diet pills can be very helpful. There's, you know, and even just short-term use. Mitch, I wonder if you have any.
Yeah, like anything over the counter is not going to work.
Thank you.
There's just generally what happened back in the 90s. We had a stack called caffeine, estrogen, and aspirin, like the precursors to meth, essentially. And they were actually fairly effective for some short-term fat loss, but they wreak havoc on your system, and you pay a pretty steep price for it later. So you are not going to buy anything on the internet, on Amazon, that's going to work. And I can promise you, because I've tried almost every single one back in the day. And you know, if anything, if you look at the research, yeah, they're just effective. I mean, who wouldn't love it? I joke, the only pill I found that really works, it's huge, and you got to keep it in your mouth all day. It just keeps you from eating stuff. And that's the only diet pill I've seen work really well.
You know, but there are some great new medicines that are very safe, you know, especially for people with significant obesity, and they're maybe even considering surgery. You know, these medicines.
Talked on that the other day. That was fantastic.
Where was that?
You and Celia.
Oh, yeah, we did. It was a couple of weeks ago, wasn't it? It was a Facebook Live.
Sorry, a couple of days ago.
Thank you. Yeah. But, you know, it was a bit ago. So if you look back in our Facebook page, we have it in the library. So I would recommend, Pauline, that you read it and certainly feel comfortable to come in for a consult with her. So where were we? Tip number 4. So tip number 5.
Yep.
Recovery is critical. If we don't sleep, if we don't stretch, we're not going to build as much muscle, correct?
Yep. Yeah, and actually sleep's really tied to insulin sensitivity. It's one of the first things we do with clients is go over a sleep history with them. Yep. And just simple things of like even arranging our bed differently, or the temperature in the room, the light. I mean, there's amazing things you can do to get better sleep that play this huge role. Like if you're well rested, you're more likely to work out the next day. You know, it's fairly good.
And that's why night sweats of menopause or midlife and menopause can be so difficult, because if you have these little night sweats at night and you have this interrupted sleep, you're less likely to work out because you don't have any energy. And when you do work out, it's less likely to be as efficient, and you're less likely to build as much muscle. So it's just critical to get that sleep. It's 7 hours a night is the magic number. And I do believe we can catch up if we get behind, but really it's that I actually now set an alarm to go to bed. And sometimes I'm like, oh, I don't want to yet. I'm not done with my work, but I just have to, or I'm not going to be as efficient. So moving quickly, we've been here almost an hour now. So it's, we got to keep moving here. So sorry, everyone, it's going so long, but this is so fun. So the next segment I always like to do is 5 questions that I want you to ask your healthcare provider. And this is only, you know, this is to really further involve your healthcare provider in your care. And almost very frankly, if your healthcare provider is not comfortable with this, maybe it's not the person you ask about this kind of stuff. So question number one that I want you to be able to ask, what is my phase of ovarian function? You're all laughing because this is my favorite question, but it's really true that as you get into perimenopause and menopause, it really changes your ability to gain weight, or rather to lose weight, to gain muscle. And it's just so important so you know what to expect. Mitch, what is your thought on this? I've been pretty impressed that you know a fair amount about hormones and menopause.
It is interesting. I think I talked to Celia about this too, is that I used to really undersell, like, menopause, weight training, and weight loss is really difficult. I mean, it's a horrible, I feel, because I don't have to go through it. And, I'm trying my best to help, and I don't have those tools. But our patients with you seem to do better. We almost a 50% better, like, curve of improvement. And I think some of that's getting those hormones balanced out. And that's actually what led me to that research on E2 and muscle mass, because like something's going on that's different about your patients than the perimenopause and menopause women I've trained in the past.
Right. Cool. And I just see, like, that paper that you sent me, talked about if two women are in menopause, one is on estrogen and one is not, the woman who's on estrogen will build that muscle faster. And it's crazy how skeletal muscle has estrogen receptors. And it was a really good article. I've shared it a lot with my colleagues. I know Dr. Simon has used that article in his work and with his patients. And so it was a really well done article. We really appreciate you doing such a great evidence-based dive. But, again, for women, if estrogen is safe for you, and it's safer for a lot more women than women think. I did a whole Facebook Live on this not too long ago. But and Dr. Simon was here this last fall, and we did a Facebook Live on how HRT is safer than you think. It's really something to consider, but for sure to know what is your phase of ovarian function, and then what are my options. Question number 2. Ask your healthcare provider, what is my muscle mass and body fat percentage? And I think it's critical that we have these scales in the medical offices that tell us this.
Yeah. I know nobody wants to get weighed unless they were better than they were last year.
And yes,
if that's your barrier, like, that's maybe a great trigger to be like, I got to do something about this.
Yep.
You want somebody you're comfortable having that conversation with. I totally understand that.
And it's not just weight and BMI, but it's muscle mass and body fat percentage. Yeah. Question number 3. Do you want to talk about this?
Yeah. How would having more muscle mass help me improve my risk factors? It's almost every single disease is tied to it. And part going back to that insulin matrix, we're starting to understand that's very tied into it. I think your doctor should have a fairly quick answer for that.
Right.
And I'm definitely seeing it with younger physicians, because it's such a part of everybody's life. But yeah, I mean, I feel for you. Like, this is what I love about sending patients to you, is because we have the same conversation, right? Like, I'm not trying to get their PCP to, like, diagnose them or, to prescribe exercise. I wish more of that was the case, though. Like, right. Rather than a drug, we're like, hey, you need 3 hours of weight training a week, and let's get it done.
Yeah. Well, and 2, even I had a patient the other day, and she was tearful because she sees her mom starting to have dementia. And she's like, I do not want dementia. I want my brain to be healthy. And the biggest risk factor for dementia is the same group of risk factors for dementia is the same group of risk factors for heart disease. It's high blood sugar, it's high insulin, it's high cholesterol, and low vitamin D. It's if those blood vessel walls are sticky, that fat sticks and it clogs things up. So again, muscle mass helps all of this.
Well, and almost all of that comes from a liver disruption, right? That non-alcoholic fatty liver disease. Yeah. And we know weight training is one of the big things that reverses that.
No, I love that. Emma, your question about, are there any scales we can use at home that you guys would recommend to measure body fat and muscle mass? So first of all, I don't know if you guys have been following this, but I'm also now CEO of a company called Kyria. And at Kyria, we're developing a kit of wearable with a continuous glucose monitor and a scale. So if you were to participate in our user group, we'll hopefully be having this kit all ready to go by June, certainly by July. In using this kit, you'll have all of these tools together that will feed into an app and then allow you to really have personalized information and personalized guidance. So please stay tuned. We will have this kit available, but there are certainly scales available. It's just making sure you get a scale that's been calibrated. And the scales that we have in the office, I think the initial scales we bought were like $250 a piece, but I got on the scale and then I went and did a DEXA body scan. So it gave me my percentage of muscle mass and body fat, and we were able to correlate it with the gold standard. So make sure that you've got a scale that's good if you're going to do this. And hopefully soon we'll have the Curia kit and you'll be able to have that in your home. Number 3, ask your healthcare provider, number 4, how would building muscle help me feel better? So again, right, we want our healthcare provider to have quick answers for this. Depression, self-image, sex drive, it helps it all. So again, please be, I hope you're with a healthcare provider that can answer this question. Of course, we'd love to see you at True. If you're in the state of Michigan, we'd love to see you. But wherever you are in the world, make sure that you can ask your healthcare provider this question. And question number 5, right? What is my bone density? And if you have at least 2 risk factors, menopause and you're a woman, right there, you can get a bone density paid for by your insurance. So make sure you know your risk factors. If you've been on steroids, oral steroids for asthma, if you have had a time in your life where you drank alcohol on a regular basis, that's a risk factor. If you had low vitamin D in your life, that's a risk factor. If you have rheumatoid arthritis, that's a risk factor. So make sure you know your risk factors and get a bone density test. So on that note, we've been at this for an hour. Again, we could keep talking. Mitch, is there anything that you want to leave us with?
Don't let that intimidation factor scare you. Find something that appeals to you. Ask your girlfriend what she's doing. Go to a class with her. Find a good trainer in your area. Learn from them. I love the referrals. That says a lot. And so if somebody's like, yeah, I'm with somebody, they really seem to know what they're doing. It's a confusing world out there, but don't let that stop you. Find something that you can really dive into and just get started with it.
I love that. Thank you so much. And it's all about, having your goal, having your picture of self, and then working to find ways to reach it. So thank you, everyone. We'll look forward to seeing you on the next Facebook Live. Any questions, please let us know and be happy to help. And thanks, Christine, for your comment and for showing up tonight. I just got shivers. So Mitch, thank you so much. And can't wait to be there next week.
All right. Thanks for having me.
Thank you.